We're running a little behind. So the next, we're having a few changes to the schedule because one of our speakers is not here. So what we're gonna do from now on, we're gonna have time now for the poster session. Yes. So we're gonna have the time for the poster session. Everybody is gonna come here to the auditorium. There's not gonna be the breakout sessions will happen here also in the breakout sessions. So what is going to happen? We'll have again the poster, and then Dr. Weiss is gonna be doing her presentation from 1:45 to 2:30. And then, yes, here in the main auditorium. And then at 2:45, 2:30 to 2:45, it's gonna be a break. You know, it was gonna be a transition to this auditorium, but we're already here. So you'll take a bio break. At 2:45, Dr. Karen Gregory will do a presentation. This is a pre-recorded presentation, but she will be available for questions and answer. Unfortunately, Dr. Joy Lucas, she's a pediatrician, so things happen. Maybe, we hope and pray that she's okay and her patients are okay. This is my assumption that an emergency came up. And at 3:30, we will have Dr. Amadisharaf and colleague. And then at 4:30, we'll start with the Florida Asthma Coalition Work Group updates, and we'll continue. But there's just a change on speakers. We're not going to have Dr. Joy Lucas. We will have Dr. Karen Gregory instead on that position. So, yes. Okay, thank you, guys.
Hello, everyone. I'm very proud to introduce Jocelyn Lawrence, MD. She's a family medicine specialist in Miami, Florida, and has been in practice for 27 years. She graduated from the University of Arizona College of Medicine in 1995 and has been the Chief Medical Officer for Jesse Trice Community Health Center since 2016. When I saw this, I fell in love at first sight. I've been working with at-risk teens for more than 30 years, and not too many people want to do interventions with adolescents. More of the interventions are younger or older, and she did one engaging senior high students in a coordinated school-based asthma program. So without further ado, Dr. Lawrence.
Thank you. Good afternoon, everyone. And yes, I've been with Jesse Trice for about 7 years. Prior to that, I was with the University of Miami for about 18 years. And even there, I was involved with the school health program. So for pediatric asthma, it's something that our school health team and I have seen a lot of over the past few years. And I thank you for inviting me today to share with you. So a little bit of background about Jesse Trice Community Health System. It's a federally qualified health center located in the heart of Miami. We provide care to all ages, actually, and you'll find us in sections of Liberty City, Opa-locka, Hialeah, and Miami Gardens. In 2022, we provided care to just over 43,000 patients. I can tell you that 51% of our families live below the federal poverty level. 60% are Black, 30% represent Hispanic ethnicity. And I can tell you that we're in areas that are designated as health professional shortage areas and medically underserved areas. I can also let you know that the national and state averages we exceed in certain areas for cardiovascular disease, diabetes, HIV, cancer, and asthma included. So our schools are therefore in areas where poverty is a concern, and safety actually can be a more pressing issue than someone's health or perceived to be. So some of our students reside in the oldest public housing facility known in the nation. That in itself represents a setup for poor asthma outcomes. So only now is that area undergoing redevelopment. And we all know that adverse social determinants of health only contribute more to poor asthma outcomes for children and adolescents. So for us, we set out to engage a group of high school students and their parents known to have had frequent school absences for reasons that include asthma. We wanted to determine if we could engage them on Saturdays for the duration of 5 modules. We also wanted to know if the digital divide would have an impact and how many would have noted improved asthma outcomes as determined by their emergency room visits or hospitalizations. So in looking at our outcomes, we were able to engage 12 students along with their parents on Saturdays. All of them completed the course. Before the program, among them, there were 87 missed school days. That's about an average of just over 7 days per person. Before the program, and I want to go back and say that this was in February, so not even half of the school year was over at that point. So before the program, 7 of the 12 students had reported emergency room visits for a total of 25 visits together. The program courses ran from February through May. Students were then reassessed at program end and again at the end of the academic year. And I have to say that there were no absences reported and no additional emergency room visits reported either. All of the students were given asthma action plans by our school nurse practitioner. And to note, only 1/3 of the students reported having had a primary care provider that year, attesting to the need and the importance of school health nurses. So in conclusion, Saturdays nor the digital divide impacted the classes or impeded them. And there have been notable improved asthma outcomes for each of those students. And I have to say that it also made a difference having dedicated and engaged school health staff that the students could trust and seek out help from, not only just for their asthma, but other conditions as well. So our students actually shared a number of comments. Some of the notable ones were that thinking that they could not participate in sports, not knowing proper protocols in terms of maybe using their inhaler before they set out to exercise. A lot of them also pointed out just how valuable the school nurse was to them as well. So our plans for next academic year are we want to reassess those 12 students and see what type of progress they've made. And then we will also continue engaging the high school students as well.
Dr. Lawrence, I just wanted to say, I was at Jesse Trice for a health fair a few years ago, and I heard about the gun violence issues and so forth, and like, more kudos to you for being there and hanging in there because they need you very desperately, so thank you so much. Okay, I think, Lincoln, do you want to just get that up? Okay, so while they're loading this, because my presentation was loaded in the other room, you saw the little warm-up today that we did. That was more for stress management, but there are many benefits to exercising, whether you have asthma or not, and there are many problems if you do not over a lifetime. I just peer-reviewed an article that appeared in the Journal of Asthma recently on a huge study of sarcopenia, and I'm going to mention it in my presentation. It was done on a population in Korea, and sarcopenia is the use of muscle strength, and it can lead to loss of mobility and increased risks of falls and fractures in old age. So it's really important that there were associations made between this very large sample between the geriatric community dwelling population with asthma, lack of physical activity, and sarcopenia. So we'll see more of that later. The good thing is it's free. You know, you can just get out and walk. You don't need to buy any fancy equipment, join Equinox Gym or anything like that. You can just get out there and walk and put you in much better shape. So, all right. So there we go. Thank you so much, Lincoln.
Absolutely.
Let's give a hand for our tech who made me great today, right?
All right.